This is Christine Porter with the Times News. We are here today with Dr. Gajula, a pediatrician with the Lehigh Valley Health Network. The topic is about COVID symptoms in children.
COVID symptoms, fever. Again, parents have a notion about fever. 99, it's not fever. Temperature 100.4 or above is considered fever. That is persists, not for one reading if the fever persists. Fever, if they have a sore throat, if they're coughing, difficulty in breathing, headaches, abdominal pain, vomiting, diarrhea, those kind of things are the most common thing we need to look at. There is a rare disorder. It's not too common when it is called multi-system organ syndrome. That is rare. And noted to be in younger children. These children who have been exposed to COVID virus, not necessarily they have active infection or somebody in the family has a COVID virus infection. These children develop the symptoms that involve, this is the syndrome whereby it involves the multi-organs, like skin, they have rashes, the eyes get blood injected thing, the tongue gets like a strawberry like tongue, they have other rashes too, they have involvement of the gastrointestinal symptom, vomiting, diarrhea, neck pain, lethargy, they become very tired. The fever persisting, these are the things that you may have to have the child to be admitted in the hospital, taken care of.
And that's rare.
Is rare. If the school reports your child might have been exposed to COVID, again, you need to find out if the child is exposed in the same room or some another room in the school. The child, if is exposed in the same class, I think a lot more risk of transmission of the virus. If the child is exposed, we need to watch your child for symptoms of the COVID symptoms, like I mentioned, and each child may need to be tested for COVID virus infection. While we are waiting for the COVID virus infection, you may, for 14 days, you may have to watch the symptoms, try to observe quarantine-like symptoms at home.
Stay within one section of the house that the rest of the family doesn't go into?
Yeah, I think it's difficult. If a younger the child, it's harder to do it, and also they refrain from hugs and kisses too. That's what they recommend, but I don't know how much is possible. That's what it is. If younger, the 5-year-old comes down sickness, and you are the mother, how can you keep him away without hugging or something? But I think that also will spread the virus. Making sure that he's well hydrated, make sure he's well nourished, watch his symptoms carefully. If he's developing severe disease, like a difficulty in breathing, those need to be watched carefully. Meanwhile, your other family members need to be tested for COVID virus thing too. In severe cases, obviously the child need to be taken to the emergency room.
Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.